Whiplash. Whiplash injury is a very important question in orthopedics actually. What is whiplash injury? Whiplash injury is an injury usually sustained to the cervical spine as a result of sudden deceleration of the vehicle. Sudden deceleration of the vehicle means that is due to the impact of the vehicle. Okay. How it is caused? It is caused by either acute hyperextension followed by acute hyperflexion, acute hyperextension followed by acute hyperflexion, or opposite, acute hyperflexion followed by acute hyperextension. Okay. Use your common sense. If you are going in a car, if your car hits with another vehicle, head-on collision, normally you go for acute hyperflexion, then hyperextension. But if you are sitting in a vehicle, if some vehicle hits you from the back, then you go for hyperextension followed by hyperflexion. That means, if at all they ask, where do you see whiplash injury more commonly between head-on collision and rear-end collision? Your answer should be rear-end collision, because one is more dangerous than two. That means acute hyperextension followed by acute hyperflexion is more dangerous than acute hyperflexion followed by acute hyperextension. That means it is a hyperextension form of injury. It is a hyperextension form of injury. Why? The whiplash injury due to tear in the anterior longitudinal ligament. Tear of the anterior longitudinal ligament. You know, in the vertebral column anteriorly, there is a ligament known as anterior longitudinal ligament. What happens? Once there is sudden hyperextension, the anterior longitudinal ligament gets tears, the spine gets destabilized, it may get dislocated or get fractured, or fracture dislocation may take place, which may cause laceration of the spinal cord. And when it is followed by hyperflexion, there may be self-reduction of the dislocation. Okay, remember that. I will explain later. Okay. So, as I mentioned, there will be dislocation or fracture dislocation of cervical vertebrae with laceration of spinal cord without any external evidence. A person may be brought dead, absolutely no injury, even after opening the thorax, abdomen, cranium, then no injury. Now you should think about whiplash injury, because there may be dislocation and self-reduction. So, you don't see any evidence. So, you have to examine carefully. Okay. If I ask you a question, whiplash injury is more common in driver or front seat passenger or back seat passenger? What is your answer? Remember, whiplash injury is less common in driver. Why? Because driver will be more alert at the time of impact and he tries to stabilize his neck. So, for example, imagine I am driving my vehicle, and when I am about to hit, I may hold the steering firmly and try to stabilize my neck. Whereas, the front seat passenger not aware, back seat passengers anyway, they will not be aware, because I don't think they will be always watching, unless they are traveling in a vehicle with a risky driver. They will be totally unaware. Sudden jerk may take place in the neck and they may sustain whiplash injury. Okay. So, because of this whiplash injury, there may be Atlanto-occipital joint dislocation, which is seen in about 20 to 30% of cases. Atlanto-occipital dislocation takes place 20 to 30% of cases. Okay. or else it may take anywhere in the cervical spine usually, but normally at C5, C6 level, C5 cervical vertebrae, 5th and 6th cervical vertebrae level, it may take place. Okay, remember that. Many times, people think that whiplash injury means it involves only cervical spine. Not exactly. It can affect even the dorsal spine, thoracic spine, where in case of driver, why? Once there is sudden impact, the tendency of the driver is to hold the steering wheel, and at the time of impact, suddenly he may try to move his body backwards, then front. There is hyperextension of the thoracic spine, which may give rise to fracture or dislocation of the upper dorsal spine at the level of T5, T6, T7. T5, T6, T7. So remember, whiplash effect not only in the cervical, normally in the cervical spine, may be seen in dorsal spine.